Hey y'all. So as promised, I have some resources that I've used over the past 2 months, and also some that I'm still using that I used while I was in school. So first, I'll kind of go over like the first two things that I thought were kind of a little bit of a waste of money that I bought. I got this book. It's an antibiotic, basically book. Uh, my preceptor was really big on this book when I was in clinical, but honestly, for me, it's too hard to read. It's very, very small. You can see, like, it's really tiny, and the way it's kind of broke down for me, I really didn't like. It kind of confused me more than anything. So, this antibiotic book was a no for me. And if you have it or if you've ever looked at it, you'll see what I'm talking about. She absolutely loved this book. She thought it was one of the greatest things. She carried it around, like it was a baby. Like she never left without it. But for me, too small, kind of confusing. I never used it. I tried, but I just kind of got thrown off with it. Another thing that I bought, but is still maybe kind of a waste of money for some people, but sometimes I just like to have something in my hand. I got this 2016 Guideline Book. The reason I bought it, like I said, is because I was not feeling very confident. I was second guessing myself. So I bought this book. I honestly have used it probably one time. The thing with this is it's good if you need a quick pull to, but if you think about it, an app or a website or something would be better because obviously we know guidelines change. For me, yes, these are new right now, but this will be out of date eventually, so could be a waste of money. But for right now, it's okay. And like I said, I really haven't had to use it that much, but I do like having it in my back pocket. So not very much money, under $30, I think, probably like 15 or 16. You can get it used. But it's kind of nice to have it as a backup. Something that I used while I was in school, it was kind of like on the recommended reading list or whatever, is a differential diagnosis book. I didn't use this really when I was in school. I did buy it because I found it kind of cheap. However, I kind of think it's neat now that I really kind of understand more as to compare to when I bought it. This differential diagnosis this book is about like the most common complaints, and I think you can get this pretty cheap as well. It goes over like the common things like insomnia, knee pain, fatigue, facial pain. It doesn't diagnose something, but it gives you, kind of like the symptom, like a headache. Let's see, like headache. And then what this book will do is it kind of goes through and, gives you like a little history and the natures of pain and what it could be and associated symptoms, things like that. So now that I understand better, I do kind of like go to this book every now and then. And for something cheap that I already had for school, it is kind of nice to throw on your shelf at work or in your drawer. So not a bad book. I have actually used this a couple of times in practice, especially for like syncope and things like that. Or headache. Just sometimes if you just want a refresher. So I have used this book. I do kind of like it. I wouldn't go out of my way to purchase it, but if you already have it or you find it super cheap, always good to have too. This is a book that I don't know where I got it from, honestly, but I was telling another student that was at my clinic the other day about it because I have actually used this book several times. It's a dermatology book, and we looked on Amazon, and you can find it for like a penny. For a penny or for like $4, this book is definitely worth it. This has like every like dermatology problem you can think of with big, beautiful pictures in it. And the good thing about this is even if this is, outdated, these skin conditions don't change. They're pretty classic, and there's so many of them, and each condition has like a really nice picture, and it goes through and it helps you with the diagnosis and like testing and also differentials as well. So this Color Atlas and Synopsis has been a good book for me. I have used it a couple of times in practice. So, good book. Let's see. Another book that I actually like, I ordered this book first and I sent it back. When I first got it, I opened it up, and this is before I actually started my job. I was like, holy crap, this is a bunch of junk that I don't need, because when you first look at it, it's kind of scary. You look at it and it's like, what the heck is that for? You get all these like, little bullets, and you're like, oh crap. And it can look a little overwhelming at first. But as I started working, I actually ordered this book again and took a second look at it. And I'm really glad that I did, because I do use this book probably every other day at work. And I'll tell you why. I don't use it as a crutch. I kind of go back to it as like a just kind of second, a second check. But you can go and look for something like hair loss. And this will give you a little general discussion, but then it gives you all the things that can cause it, and things to check for, what labs you should be looking for in order to diagnose. It gives you your general workup, like the first things that you would do, and then it gives you a deeper workup if you need to go further, like what would be next after you did the first, couple of primary tests. And this also has an app that I use. Also, it comes with a code. And you can download the app. So I use the app too. So if I'm in a room, I use the app and I need something, or if I'm at my desk, I'll use the book. I actually kind of like to hold on to the book. I like that better. I can just flip through. It's a lot easier than using the app to me, because I'm usually squinting my eyes or scrolling through it or whatever. But I do like this book. This book was $18. You can probably get it used. But definitely has been a really good help. I use this book probably the most. So recommended book, has helped the students too that have come in, and they like it a lot too. Now this is next book is a book that I used when I was in clinical. I got it my last term. I wish I had known about it before. This is the 5-minute clinical, which also I think you can buy an app. I think this gives you 10 free days or something. The app was fine. You can also go on the internet. I don't know. There's a bunch of different avenues with this book. I don't think they're all free, but once you buy the book, you have the book. But the online stuff, I don't think is free. This 5-minute clinical book I have used probably on a weekly basis. I really like this book because, it basically does the same thing kind of as the instant workup, but kind of a little bit more succinct and kind of easy to read. And it kind of breaks everything down for you. It also gives you diagnosis codes if you need them here on the side. It gives you clinical pearls that you might need for that diagnosis. It tells you, it gives you description. It gives you epidemiology, the etiology and pathophysiology, genetics, risk factors, general prevention. It gives you history, the diagnosis, everything that you would need to come to that conclusion, what tests to take, medications or therapies that you would use. So honestly, this was a really great book. I don't know, probably expensive. I don't remember. Under $100 for sure. I would say probably $80, but you could, like I said, get it used as well. But really, really a great book. When I was in clinical, this book made me sound like I knew what I was talking about. And most of my friends bought this book too, and we used it a lot during clinical. And like I said, kind of on a weekly basis, probably a couple times a week that I use this book. I'll pull it out just to kind of refresh myself on something, or make sure that, I'm on the right track. But all kinds of diseases in it, crazy things you've never heard of, and then things that you're probably familiar with. So also comes with guidelines and things like that. So that's a great book as well. Apps and websites. So I guess it kind of really depends on, what you like. I got Lexicomp through my school and Epocrates later. Like a discount they were offering, so I got them both because I knew my Lexicomp was going to run out. And between the two of those, I can't say which one I like better. I was used to using Lexicomp, so I kind of always gravitated towards that one. It depends on the subject, but I'm seeing a difference. I'll now use them both because depending on what it is, like either Lexicomp or Epocrates, they usually surprise me and someone gives more information on the other. So now I'm like, well, crap, now I have to use 2 apps. So I've kind of gotten used to just going back and forth and using them both and seeing like what each of them says and kind of like picking from that, because sometimes the things are different. One thing that I really like, if you have to pick one and you have to spend the money, I would probably say go with Epocrates. I mean, they have a free version. I don't have that one. I think I ended up having to pay $50 or something like that for the full version. I did have that one, but what I like is something that I use probably on a regular basis. I would say at least every day, every other day, something just to kind of check myself. If I know, say my nurse goes in first and she kind of gets the history of something, or if I kind of know what's going on the app, there's this little differential diagnoses button, and if you click that, you can put in all of your symptoms that they're complaining of, and you can hit result. You have to pick the age of the patient, if they're pregnant, whatever, male or female, and then it'll give you like a list of things that, I don't know if you can see it, things that it could be. And when you click on it, and it gives you kind of like, from top to bottom, like which one is more plausible. And you can just click on it and you go through, and, if you think that's what it is, if you're stuck, then, it'll help you with the treatment and things like that. So that's something that I really like about Epocrates if you had to choose. I think that feature is good. They don't have that on Lexicomp. So also another thing that friends of mine use, which I don't particularly like, was like the F&P notebook. I didn't like that app. It confused me, so I got rid of it. Once you're used to like more streamlined, and that just didn't work for me. So no good. My friend Brittany, she likes it, but I did not. I'm more of kind of like, I need it right in front of me. Don't give me 500 options to choose from, whatever. Another site is UpToDate. UpToDate is good. There's an app. My UpToDate ran out. I spent quite a bit of money on that when I was in school. And honestly, I really did not use it that much. I know a lot of people really, really like UpToDate. And UpToDate is good if you have time to actually sit there and read for a long time. Obviously, it's always up to date, hence the name. But I honestly don't use it that much. I have it through work now, and in the 2 months that I've worked there, I haven't used it at all. That's not to say that I won't ever need it, but honestly, to me, it's a little bit confusing. You can click on way too many things, and they have so much information on there that I kind of get lost in it, and I end up just clicking on all these things, and by the time I'm done, the original thing that I went for is buried. So, I don't know, y'all may have better luck. I mean, I have a little ADD going on, and I just kind of cannot stay focused with it. So, y'all might like it better. It is very expensive, so if you're going to buy it, just, maybe kind of see if you can do a free trial first, because, I kind of wished I hadn't spent the money on it after I did. The only good thing about it is that you can use it later for CEU credits. It kind of like calculates your time up, which is, good, but that's if you buy it. I have it through work, so, it doesn't personally go to me. It's kind of like just kind of an open thing, but, good, but, you can also use it for free and get, certain information as well. I would say the most important resource, as I said before, is a very good mentor. someone else in the office that you trust. However, you don't always trust everything that they say. I know it sounds bad, but you use them for guidance. You don't use them as like they are the name, the word of God, because they could be wrong too. So you heed their advice and then you check it. And that's not being a jerk. That's just covering your own butt. I have caught a couple of things, since I've been working, and I'm with nurse practitioners that have been, in the field for 18 and 14 years. And they've told me things that I've caught them on, and I've had to kind of educate them, and I use it as like a teaching moment, and, to kind of be like, the guidelines have changed, or, this isn't really how it's done anymore, or, suggest something else. And it's been taken very well so far. So just always heed someone's advice, but always double check. And you don't have to let them know that you're double checking. You don't have to let them know that if what you found was wrong. And you don't have to not trust them if you find something that is, incorrect or different than what they said. Like I said, use it as a teaching moment for them. And, don't burn your bridges with them, because they're going to be a great resource throughout your entire time there. So, everyone obviously has different ways of doing things, but find what works for you. So those are like the things I've kind of used the most. I don't really know what else to say except good luck. Google is okay, but make sure your references or your resources are legit. You don't want to be reading off some crazy stupid website. There may be some other websites, because I know that the doctor at my practice, she uses some website that I don't even know what it is, but I know that it's legit research. I'll have to find that out because she uses it a lot. But anyway, I hope this helped a little bit to help you in your first, couple of months or year of nurse practitioner. If I find anything else that I'm using a lot or any other good resources, I'll let you know. Have a good one.